Hello, everyone, and welcome. Thank you so much for joining us here at the Center for Global Development for today's virtual event on insights and lessons learned from COVAX. I'm Janine Madan-Keller, the Deputy Director of the Global Health Policy Program and a Policy Fellow. The response to the COVID-19 pandemic yielded countless lessons learned, including from the experience rolling out vaccines around the world. Of course, the development of these vaccines was the fastest ever. And as research from my colleagues at CGD has demonstrated, the vaccine rollout was the fastest in history and was also unprecedented in scale. To date, COVAX, which is the vaccine pillar of the Access to COVID-19 Accelerator, Act A, and its partners have delivered 2 billion COVID vaccines to several countries around the world, of which 1.75 billion vaccines have gone to some of the poorest countries under the COVAX AMC initiative. But of course, as we all know, the timing of this rollout was a real issue. Vaccine supply was extremely constrained in 2021 at a time when many countries needed these vaccines the most. The process was also extremely inequitable with long delays in vaccines reaching low and middle income countries. But despite the staggering health, social, and economic costs of the pandemic, we're unfortunately seeing policymakers shift their attention to other priorities, with issues like the war in Ukraine at the top of the political agenda. And there's a real risk that we might shift from this phase of panic to one of neglect without heeding vital lessons and without meaningful change. There's much work that's still left to be done to make sure the world is better prepared to prevent the next outbreak in its tracks. And I think it's important for all of us to pause and reflect on the learning as the global health community and the broader international community deliberate future pandemic prevention, preparedness, and response mechanisms. So we have a great panel in store for you today. I also wanted to share we'll have time for audience and Q&A at the end. So please do send your questions in real time. You can share these on Twitter. We are at hashtag CGD Talks, or our handle is at CGDev. You can also email us at events@cgdev.org, or you can comment in the YouTube chat window. So I just wanted to share briefly that the goal of today's event is really to take a forward-looking view, of course, acknowledging that we are having this conversation with the benefit of hindsight. I'm hoping our speakers will reflect on what they see as the most salient lessons, talking about the challenges, but also bright spots from the experience of COVAX, and really focusing on what and how we should be doing differently going forward. Our discussion is going to build from a recent evaluation report that was commissioned by Gavi, looking at Gavi's role as one of the co-conveners of COVAX in administering the COVAX facility and the Advanced Market Commitment, AMC. The evaluation provides a balanced critique of the different elements, mostly focused on the initial design and early implementation period. I'm hoping also that the conversation will move beyond the parameters of the evaluation to talk more broadly about the COVAX experience and COVID response. So before we move to our panel, I'm going to first invite Rob Lloyd, who's a managing partner at Itad, the firm that led the evaluation, to share some really brief scene-setting remarks to help shape and ground today's conversation. Rob, over to you.
Thank you. Thanks, Janine. Delighted to be here today. It's great to see so many people joining this important discussion. So for those of you that don't know Itad, we're a global consultancy. We support clients to use evidence to make better decisions and improve their impact. And as Janine said, we conducted the independent evaluation of the COVAX facility in AMC that was published in May this year. I wanted to start by just saying how much of a privilege it was to have had the opportunity to evaluate the vaccine response to COVID-19 and to help the global community learn from such a unique and unprecedented time in global health. But in conducting this evaluation, Itad, we also recognise the gravity of the moment and how critical our role was in cutting through the noise and in the interpretations of what had happened, and to take a really independent, robust, comprehensively, and most importantly, evidence-based view of how COVAX unfolded. So I'd like to congratulate the evaluation team for producing such an important report, and to thank all of the stakeholders, many of which I'm sure are in the virtual room today, who contributed to the evaluation, and really to commend Gavi for being so open evaluation to being evaluated in the first place and engaging so well with the findings. I'd also like to recognise the incredible efforts of all those involved in the COVAX facility and the AMC, working in such challenging operational contexts. So before I pass over to others to get into the meat of the evaluation and discuss the substance, I just wanted to say a few framing remarks around the scope, the timing, and the objectives of the evaluation. So in terms of the scope, Itad was commissioned by Gavi to carry out this evaluation. Therefore, our focus was on Gavi and specifically the COVAX facility and AMC rather than the COVAX pillar as a whole. Given the dynamic context in which this evaluation took place, I also want to underline the timing of the work. As with any evaluation, it's a snapshot. It's a snapshot in time. And our snapshot was March 2020 through to December 2021. Therefore, all of the learnings and recommendations in the report are based on, findings from that time period. That said, the report does also acknowledge and engage with some of the very important strategic shifts and developments that happened in early 2022. It's also important to say that this evaluation doesn't present the whole story of COVAX facility and AMC because it's part of a multi-stage evaluation. The evaluation that we led was a formative baseline review, and its objectives were around providing accountability for initial results and learning for course correction. In doing this, it was really important for us that we located the COVAX facility and AMC within the wider external context, which, as I mentioned, was both challenging and ever-changing at the time. And this was important because it enabled us to draw conclusions around those things that were within Gavi's control and for which it could be held accountable, but also for those things that it had little or no control over. So I'll stop there. I hope that sets the scene. I hope it frames the evaluation, gives you an understanding of what we evaluated, when and why, and provides a useful jumping off point for the panelists and, what will undoubtedly be a rich and interesting discussion. So thank you.
Great. Thank you so much. Thanks so much, Rob. Very, very helpful. So we're now going to move into the panel component of today's event. I'm very mindful that there are, many important themes and lessons learned that emerged from the evaluation, have come out from other assessments of COVAX and the COVID response, things around, surge financing, the importance of at-risk purchasing, of course, lessons around operationalizing goals and objectives around equity, the need to focus on manufacturing, on supply, but also on downstream delivery. Lots of rich learning, but just in the effort of getting this rich discussion started, I'm going to first turn to Aurelia Nugent, who is the Chief Program Strategy Officer at Gavi. So Aurelia, as Rob noted, we, especially at CGD, really welcome, Gavi's commitment to accountability, but your commitment to learn from this experience, which in many ways was unprecedented and untested. And of course, this specific evaluation has yielded, many important lessons for how Gavi, but also other global health partners respond to future outbreaks and pandemics. And indeed, as you all have said from Gavi, you all are already working on acting upon a lot of these recommendations. So just turning to you, could you reflect on, from your experience and your vantage point, what you see as, one or two really top line salient lessons from this experience responding to the pandemic? Do these coincide with the recommendations that were highlighted in the evaluation? And then lastly, could you tell us a little bit about how you and your colleagues at Gavi are working to translate already some of these lessons into action? Over to you.
Thanks, Janine, and very warm hello to everyone. Thanks for joining, and thanks for inviting me today. I also want to appreciate my fellow panelists who have been on a lot of this journey with us, and also the Itad team, Rob and particularly Matt, for the work in putting together the evaluation. So I guess, from my perspective, maybe singling out one or two things is a bit of a sort of tricky question, because there's been so many different aspects to the experience that we had. But I think perhaps maybe to start with the fact that when we think about a design, and this evaluation was very much focused on the design outline of the pandemic response mechanism as it was embodied through the COVAX facility that Gavi ran is you really need to sort of get past the very top line rhetoric and really get into the nitty-gritty details, the processes, the systems, the surge capacity, all of the really, in a way, boring stuff like the legal and regulatory systems, to be able to really think about, what the lessons are and what you'll be able to do as you go forward. So if I can just maybe call out a few. First of all, financing, having financing on day zero, that was absolutely essential. Being very clear when you're talking to all of your stakeholders, and in the Gavi world, we're an alliance. We have a number of stakeholders and beyond in the context of the COVID pandemic. What are risk thresholds? How do we speak about the level of risk that we collectively or individually as organizations are willing to take? I guess another one that's close to my heart is how do you think about work in humanitarian context? If you think that a lot of the multilateral response that COVAX was very much embedded in was about the question of equity and making sure that everyone had access to COVID-19 vaccines, not just those who could afford to pay for it or access it. And within that equity question, particularly the most vulnerable in humanitarian context, how do you think about the legal and regulatory challenges for populations that already have so many challenges in terms of access? And then more broadly, how do you think about trade-related barriers in a pandemic setting? So I think it's really those kinds of very specific things for me that are really important in terms of some of the lessons learned. And maybe to talk to your second question, I mean, that's a little bit some of the reflections we've been doing, a lot based off of the Itad evaluation, but also a number of the papers and lesson learned exercises that we've done more broadly. So to come back to financing, having established a pandemic vaccine pool to make sure we have contingency financing, thinking about the role that Gavi has in global health security, and particularly around health system strengthening. I'm sure we'll talk more about that, but in the end of the day, it really is the strength of the health system that determines the strength of the pandemic response. And then building in terms of some of the collaborations that emerge, particularly. So I'm sure we'll talk more about it in a minute with the African Union. We've signed an MOU. We're going to be convening for the first time an African Manufacturers Forum with Africa CDC and AU next month, bringing together countries and manufacturers to strategize. I think there was a lot of learning here around sustainable manufacturing, particularly for Africa. But I think those are probably some of the key lessons learned. And in the end of the day, I think really thinking about how our investments, we talk about what needs to be done in pandemic times, but really it's what happens outside of pandemic times that's really important. And investing in our routine systems, that's the backbone of the investments in pandemic preparedness and response ultimately. And if we're able to make more systemic changes, and I think the evaluation talks to a number of those within routine systems, then we'll be much better set up for pandemic preparedness and response. Thanks.
Great, Aurelia. Thank you so much, and agree entirely. There are, lots of issues and lots of complexities within each of those thematic areas and issues to talk about, and hope that we'll dig into some of those a little bit. So, jumping off of your very important point about reflecting and acting on these lessons outside of pandemic times, and keeping in mind the fact that one of the key messages of the evaluation really was the need to think about the end-to-end approach if we're going to really be able to secure equitable access to vaccines in a pandemic, meaning, focusing on the full range of steps and processes that we need to think about to actually get these vaccines to end users, from upstream manufacturing, which you touched on a little bit, Aurelia, to last mile delivery. So I'm going to turn on that note to our colleague Matt Cooper, who co-led the evaluation as part of the Itad team, and ask you, Matt, to reflect a little bit on this sort of overarching learning of the need to focus on these end-to-end aspects and functions that we really need to be mindful of the next go around. And of course, acknowledging that, there are different agencies that have and actors within the global health space that have, unique mandates and capabilities, but that we really have to think about this as a continuum if we're going to sort of get things, if not right, at least do things better the next go around. So speaking from your vantage point as one of the lead authors of the evaluation, could you reflect a little bit on this big picture learning around sort of thinking about this end-to-end approach? And I'd love also if you could touch on some of the specific functions, things like the importance of technology transfer and how those really play into the, broader efforts and conversations around strengthening global systems for pandemic preparedness and response. Over to you, Matt.
Sure. Thanks, Janine, and hi everyone. There's a lot in there, but let's just quickly, try and capture what we mean by end to end. I think, we're talking about increasing global supply. We're talking about procurement of that supply, the allocation and distribution of that supply across countries, and then actually supporting countries with vaccine rollout. But I think we're also talking about some operational things like resource mobilization, governance, country engagement, advocacy, and communications functions. And across COVAX, there was some really good and some less good practices in that regard. But I think overall, there's scope for better cross-organizational working next time around. And I already did touch on it. I think she's absolutely right to raise the need for a strengthened approach to increasing global vaccine manufacturing capacity. And that can be done now, but it's also got to be developed in part, as I think, as a mechanism to rapidly expand vaccine supplies through tech transfer and IP sharing agreements in the event of a future pandemic. And that in itself is going to require much closer working between agencies to ensure that those agreements work for all parties. I think, the evaluation gets at this, but the emphasis on this area stems from the realization that without it, any multilateral procurement mechanism is going to struggle to secure significant volumes of vaccine in the initial phase of a global vaccine rollout. It's at that time when competition for scarce doses is super high, countries are serving their own populations first, and companies are pursuing their commercial interests. And, let's be under no illusion that those behaviours will be replicated in a future set of similar circumstances. It's probably also likely that even with the actions we're talking about here, it's still going to remain a struggle to compete for doses, especially maybe if only one product is successful in clinical trials, and given the time it may take to successfully manufacture a vaccine through a third party. We got pretty lucky with COVID-19 that there were so many successful vaccine products, including some whose manufacturers were willing to engage in tech transfer. So I think that brings me to trying to answer the second part of your question, which is that the broader global architecture for pandemic preparedness and response has got to try and find a way to facilitate, incentivize, perhaps even compel vaccine manufacturers to engage in these tech transfer agreements such that vaccine supplies can be scaled up as rapidly as possible. I'm personally not sure how much faith to place in a pandemic treaty in and of itself to influence high-income country and vaccine manufacturer behaviour, but it's got to at least, I think, set out a framework of best practice against which stakeholders can be judged. And a part of that future end-to-end initiative, I don't think it should shy away from making that judgment and transparently communicating the findings, perhaps even when the stakeholders being judged are the ones funding it. Thanks.
Great. Thanks, Matt. So many important points. But in segueing to our next speaker, I wanted to just pick up on that point you mentioned about sort of better cross organizational working and collaboration in these sorts of responses going forward. And jumping off of that point, let's turn now to our next speaker, Saul Walker, who's the Director of Public Partnerships at CEPI, the Coalition for Epidemic Preparedness Innovation. So broadly speaking, CEPI helps to finance and coordinate the development of new vaccines to prevent and contain infectious disease epidemics, including through instruments like push financing and direct investments in product developers and manufacturers. So sort of thinking again about this continuum, Saul, and I should also mention that CEPI was one of the co-leaders of COVAX as well. But Saul, turning to you, from where you sit, what do you see as some of the sort of salient lessons from the response that you think should and could inform CEPI's role and approach to bolstering, future epidemic preparedness and response efforts? Over to you.
Thanks, Janine, and thanks to CGD for bringing this together. And hi to Kona, and really good to see you again after many times on video screens over the last few years. So look, I'll focus on a couple of things that sort of worked well and what we might learn from those. I mean, we saw speed in R&D where we'd already had a head start in R&D. So there are examples of the investments that have been made in mRNA technologies prior to COVID. There was the Oxford work on MERS that allowed you to have a head start on coronaviruses and the viral vectors that Oxford and then AstraZeneca took up. So that kind of doing the preparedness around R&D is really important. On access and scale, we also saw we were able to do better deals with partners that we already knew, that we knew were already committed to actually equity and equality as being part of their approach and their rationale for being involved. So we saw that a little bit also with Oxford. We saw it with some of the companies who were willing to do this, and Astra obviously is one of the key ones there. We could also see examples of where we didn't have those kind of relationships set up or those expectations around access pinned down before the pandemic were then really hard. So CEPI did make some initial investments in mRNA really early in February 2020. And then when it came to a second round of investment, we were unable to compete with the R&D funding that was coming in from other high-income country R&D funders. And actually those R&D funders that were coming in made the level playing field, it wasn't there, and it was difficult for CEPI to kind of leverage a second stage deal on mRNA, and that was a real challenge. The other things that were really noticeable were obviously that we had to build the collaboration piece, and everyone always talks about building sailing boats while you're building them. I think we were flying a plane while we were building the plane and then trying to work out where to land it, because this was changing so fast. And for CEPI, that was a particular problem. CEPI was 3 years old at the start of the pandemic, so this was quite a baptism of fire to come into it. But it was very clear that as we kind of worked out how to work together, that actually some of those basic things that Aurelia mentioned, roles and responsibilities, handoffs about as you move along the value chain, how information flows up and down a value chain, how much delegation boards are given to be able to move fast, what the risk tolerances of different organizations is. And actually, as you move along that kind of roles and responsibility chain, often we found that there were gaps a little bit about, well, who does this and what's the interaction and the handoff between push and pull, or who takes these risks and how do we share those risks. So we did work through those things, but they did slow things down. I think the other thing that was kind of noticeable, and I started the pandemic working for DFID and FCDO, was actually how this started as, there was a COVID team, and then there was a COVID department, and then this became a whole of DFID, a whole of system approach within the organization, partly focused on COVID directly, but also partly focusing on how you did your other business in a COVID environment. How do you maintain RI? How do you do other things? So recognizing that organizations still have to deliver on those broader things at the same time as focusing on COVID. And obviously for country governance and ministries of health, really even more important on the ground in country. So recognizing those kind of pulls and pushes within organizations is really important. So what does that mean for the future? Well, look, preparedness is essential. Particularly preparedness if we want to have speed, scale, and equity. If we really need to design for those three things in terms of how we think about a future response. And no single organization is going to be able to do that by itself. So it has to be a partnership approach. And I think between pandemics, we actually need to build out those partnerships. So working with Africa CDC, working with PAHO, working with a wider range of partners, really getting into some of those operational issues that we talked about. For CEPI, investments in preparatory R&D are really important. How can we build vaccine libraries? How can we build prototype vaccines that mean we've got that head start across different viral families, that mean we can move quickly when we need to against a specific pathogen? And actually, if we build those relationships with R&D partners and are clear about our expectations about speed, access, and equity from the start, then that means we can also build in those considerations, while we're not in the throes of a pandemic. We also need investments in capacity. That includes lab capacity, clinical capacity, manufacturing capacity, and the supporting ecosystems around that. And again, we need to do that in partnership with Africa CDC and the PAVM work that Akona is doing, the work that Gavi is doing, looking at an African AMC. Really try to think about what's the ecosystems around it and what benefits can they deliver in the interpandemic period. I think it's really important that we're thinking about how to keep this capacity active and live, working on real things now, as well as being ready in the future. And really thinking about how we have partnerships that have that equitable access approach really built into the core, and how do we learn from each other on how to contract for that, how to think about it, how to finance it, what are going to be the key components of that. And SEPI's been doing some thinking in that space with others. And then lastly, really to kind of map out with those key organizations, those roles and responsibilities, and to get quite detailed around that. What are the triggers for different organizations? What are the handoffs at what stage of value chains to be able to do that? What are the risk tolerances? How do we configure on an outbreak, a smaller outbreak in a region, where we can learn how to work together so that we're better able then to respond to a future pandemic? So I think all of those things are working, we're actually already working with Gavi, WHO, with Africa CDC, with UNICEF, with PAHO, on something called XFAX, which is trying to work out some of those operational issues, and then hopefully linking that into the work that WHO is beginning to take forwards on a medical countermeasures mechanism for future response. So some of that work is taking place, but it is going to be a long effort, but one that means that we're ready to move quickly when we need to. Thank you.
Great. Thanks, Saul. So many important considerations and themes that you touched on. And I'm mindful that, you made the very important point that, it's extremely critical that we focus on preparedness as it relates to sort of the R&D aspect of this. And I know quite recently that you all, in collaboration with Gavi and WHO, recently announced what's called a global virtual pooled inventory. Maybe we can come back to some of those specific examples later on in the conversation. But you also made the extremely important point that we're all thinking about all the time when we talk about COVID, which is that we were flying the plane while we were building it. And I think, we have to also focus on building the next plane now, but we have to do that through partnerships, which is the perfect segue to turn to Akona, who's another great speaker we have on the panel today. And, just to pick up on one theme that I think at least there has been a lot of momentum around is, the need and acknowledgement of a sort of more diversified vaccine manufacturing. We saw, this evaluation, many different assessments of the COVID response have identified the lack of distributed manufacturing for vaccines as a, really important barrier to rapid and equitable access. So turning now to Akona Shanjela, who's the program coordinator for the Partnerships for African Vaccine Manufacturing at Africa CDC. Welcome, Akona. So pleased to have you join us here today. I know, and many others here joining us today know that, in response to the COVID pandemic, the African Union, together with the Partnership for African Vaccine Manufacturing, has committed to produce and announced plans to produce 60% of the continent's routine vaccines by 2040. There are many other countless sort of announcements, initiatives, and positive efforts moving towards this important issue of building more geo-diversified vaccine manufacturing. So speaking, from your experiences as Africa CDC's lead for the Partnership for African Vaccine Manufacturing, I just welcome your reflections on how you all are thinking about these issues, where you see some of the greatest opportunities ahead, and would welcome you also sharing, ways in which you all are collaborating with Gavi and others to advance this agenda. Over to you, Akona.
Okay.
We can hear you. Go ahead.
I think first, before we talk about equitable access to vaccine manufacturing, we should talk about equitable access to internet, because I am struggling on this side. So thank you very much for the invitation for Africa CDC to be able to speak on this really important panel. And I think hindsight is a great thing, right? Because then you have a lot of lessons learned from the pandemic, not just about COVAX, but then I think COVAX really played a key role in the overall ecosystem in terms of really supporting the overall pandemic. And so basically, really, I think the pandemic experience has really highlighted the need for more diversified vaccine manufacturing to enhance access to vaccines, particularly in Africa. And you may recall, and we don't need to go through the challenges that COVAX had, as well as the regional efforts, such as the African Vaccine Acquisition Trust had in terms of acquiring its own vaccines, even though Africa had its own funding. I think really that's really important to highlight, because it was a struggle for everyone in terms of being able to access those really life-saving at the time of need. And so really, the challenges really led to the overall establishment of this pooled procurement system that Matt was alluding to in terms of how important it is, and ensuring that African countries came together to be able to strengthen their negotiating power and achieve better access to the vaccines. And so subsequently to that, having learned the lessons in terms of the overall struggles, then you had the Partnerships for African Vaccine Manufacturing, PAVM, being launched to overly really help diversify vaccine manufacturing globally, not just for the continent, and really improve and develop regional vaccine manufacturing capacity within Africa. So this initiative, PAVM, really, if I can just take us all back, has really aimed to address the long-standing challenge of limited vaccine production on the continent. And not just vaccine production, because, the challenges were not just about vaccines, but also having access to diagnostics, having access to the needed therapeutics. We couldn't even access oxygen. And so really, therefore, under the initiative is really to ensure that the agenda to advance diversified manufacturing is fully supported. And so we work very closely with Gavi currently, and I know Aurel mentioned our memorandum of understanding that we just recently signed, to really help harness our resources well across borders as well, to ensure that how do we support our manufacturers on the continent to be able to really be able to access and gain entry into the overall markets as it currently stands. And so we really are working in terms of consultations and communication to make sure that the advanced market commitment, or the AMC that is driven by Gavi, is really fit for purpose in supporting African manufacturers in mitigating the expected high cost as they enter into these markets. And so through PAVM, we have been engaging with various other stakeholders as well, including our member states, as well as manufacturers, and really making sure that we shorten that gap. Aurel mentioned the meeting that we are planning into ensuring that the manufacturers are able to actually voice out what their supply is or expect to supply in the near future with their own member states, in order to ensure that there is that kind of demand certainty for the manufacturers as they go and manufacture up to commercial scale. Also ensuring that we facilitate other partnerships between manufacturers as well as the multinationals in terms of technology transfer, as well as ensuring that we develop the right regional supply chains. So in addition to vaccine manufacturing, we're also focusing on really ensuring that we develop regional regulatory harmonization frameworks. I think that is really key, so that our whatever products that come out of the African continent are seen as quality and are safe for use, not just for the continent, but also for the globe itself. And so I think such initiatives, and I won't take you all through the BOL programs, market shaping and access to financing, but to just summarize and say that we really are working towards building a vaccine manufacturing capacity that promotes tech transfer and strengthens regional framework.
Thank you so much, Akona. Apologies for your connection, but I'll just add that your audio came through crystal clear. So thanks so much for sharing those perspectives. Really important points around what you all are doing, especially in terms of key considerations to keep in mind as this moves forward, things around demand, where is that demand going to come from? Are we going to have adequate visibility into the demand and certainty around that demand? Also, of course, thinking about, the broader enabling environment as it relates to regulatory systems and frameworks, all super pertinent. But I'm now going to turn to my colleague, Javier Guzman, who's the director of the Global Health Policy Program and a senior policy fellow here at CGD. Javier, we've heard lots of, the key lessons, many of the key themes that I think a lot of people would argue are, the top line ones coming out of this evaluation and other assessments and discussions and deliberations around the key learnings from COVAX and the broader COVID response. But I'd love to ask you, especially sort of from our perch at CGD, to really, zoom out, step back, take a big picture, sort of reflective view on, the dynamics around thinking about, centralized and more global mechanisms versus the importance of thinking about, regional players, regional nodes of manufacturing, pooled procurement, et cetera. And I just love to ask you to reflect a little bit on, the sort of current mechanism that we have, and the ways in which and the extent to which you think this is fit for purpose. I mean, should we be thinking about some, completely different models for the future? Are there some feasible alternatives that we think might be tractable in terms of addressing some of the very real collective action problems we're grappling with? Where do you see some key changes that really need to sort of be thought about carefully for next time? Some, key design features in how we think about mechanisms for vaccines, but also more broadly for other medical countermeasures. So over to you for the big picture view.
Thank you, Janine, and thanks to all the panelists. It's been great to hear their perspectives. I think if we think about the most important common big picture theme is the importance of planning and preparation ahead of time. Everything we can do in advance of the next pandemic. And of course, if you think about that and think about what the Holy Grail is, one could say, we need an ambitious but implementable pandemic accord. That is, the Holy Grail. Now, will it materialize? Will it be enforceable? Will it be ambitious enough? Will it be ratified? I'm not very optimistic based on what I've seen. So if that doesn't happen, or if that happens but it's not enforceable, or it's not, what we all need as the globe, then we need to move into the second best option, which is realistic options. And the realistic options basically come with a very important question, which is, what's the scope? What's the ambition? Everything we've heard here, most of what we've heard here is, how do we do this again? And again, basically means a global mechanism to ensure equitable access. But I don't know if global is the answer for all the different functions that we need to do in response to a pandemic, or all the preparation that we need to do in response to the pandemic. And I think I would argue that a lot of the architecture will need to be constructed at the regional level. A lot of the pandemic risks are not global in nature. A lot of the responses will be regional in nature. The decision making closer to the governments that are actually facing their citizens would be easier if there's more control. But of course, I understand the importance of global public good. So I think that balance is the key question. The balance between what you develop, what architecture you develop at the regional level, and how you actually develop those global public goods and those regional public goods. Also, I would say, realistic options do exist. And we need to work on those, despite not having a global agreement, or not having a holy grail, or not having a clear roadmap. And those include, issues with financing we heard of, issues about governance, issues about legal frameworks, operations, main functions, market shaping. So if we think about every single one of those, there are things that donors should do, and things that different governments should do. So think about financing, for instance. The conversation when we supported the G20 high-level panel on pandemic preparedness was to create a global health threat fund to mobilize $10 billion per year. $10 billion per year to be prepared. Of course, that didn't happen. And of course, we have the pandemic fund, which is much smaller, but how we can maximize the investments done by the pandemic fund to support pandemic preparedness. And now, what is the conversation on surge financing? There isn't any conversation on surge financing, and I think that's the other key element I would like to bring. I'll bring into the equation the international financing institutions, the MDB reform. We've got new heads of the World Bank, the Inter-American Development Bank. But how can we, as either regionally or globally, agree on a framework to provide swift, scaled-up access to funds in response to a pandemic? And that, of course, could be, relaxed rules on country borrowing, or it could be automatic access for pre-qualified countries. I think the financing point that it is not so much about pandemic preparedness, not so much about surge, but it's about timing. It's about, having it ready to go. So that's one example. But if we go to the other elements, I really think that we should discuss much more the point about diversified manufacturing. I think there's a lot of appetite, a lot of political will. President saying we'll have vaccine manufacturing here. Regional groups saying we'll have vaccine manufacturing in the region. Global groups saying we'll support vaccine manufacturing of diagnostics and therapeutics. But clearly, one, we need to understand that there is a trade-off in relation to policy objectives. If you want to have a diversified vaccine manufacturing, you sacrifice some economies of scale, you sacrifice price / affordability, and that needs to be clear. So I would argue that it is important to have those explicit trade-offs on the table. The point that we just heard about demand is so important, because this is not about creating manufacturing capacity that will only be used for pandemics. So I think there's much more to do in terms of being honest and clear about what the ambition is, what the reality is, and what the relationship between the national, regional, and global levels are. But I'll stop there so we can have a conversation. Thanks, Janine.
Great. Thanks, Javier. Thanks so much for those reality checks on things like manufacturing. But I really wanted to pick back up on your point about financing, since that seems to be a common thread, unsurprisingly, at a CGD event that has come up. I know Aurelia and Saul mentioned it earlier, and I'm hoping we can dig a little bit deeper. There's obviously this question about having adequate financing ready to go. And I think the timing, as you said, Javier, is really, really key. And I think that's just something that we really need to be mindful of when we think back on to the COVAX experience, is that the timing of that financing, having it ready to go. I know we sometimes call this day one, or sometimes even day zero financing. But another aspect of this, which I think is also critically important, that Aurelia and both Saul touched on earlier, is the fact that we also want to be able to have and take risks with that financing. So have it be available, but have it be available to us in a way that enables risk taking in a way that I think we saw some, especially sort of higher income countries, being able to do. Operation Warp Speed, of course, is the example that comes to mind. I'm mindful that hindsight is 2020, but with that hindsight, I'd love to dig a little bit deeper into this point about surge financing and at-risk funding. I understand those are both complicated and complex issues in of themselves, but I think they're both important. So with the benefit of hindsight, digging a little bit deeper on some of the points that Aurelia and Saul made, and I'd love to turn back to both of you about, how do we think about risk? I think we've all been talking about the importance, but when you get down into some of the more practical operational considerations, how much risk, how much is too much, how much is too little, how do you balance that? Saul made the really important point of how do you balance it across different actors and share that risk. Aurelia, I'd love to invite you to share a little bit about how you all are thinking about this at Gavi. I'm mindful you all are, approaching your next strategic period. Gavi 6.0 is around the corner. How are you all thinking and grappling about these extremely complex issues as you look forward to that period within Gavi? Over to you.
Thanks, Janine. And I think you're touching on a really important topic. And maybe if I can take it back from the perspective of time, in the sense of by the time you're talking about your day zero financing, or a lot should already be in place. Or I'd like to think we've learned from our experiences this time round. And this is really coming back to the point that Saul was making, that actually there was a lot that we were able to capitalize on that had been done. So mRNA platforms had been under development for over 10 years before we had a COVID mRNA vaccine. And so I think it's that systematic investment in terms of the modalities that we need to look at. So whether it's from a vaccine science perspective, making sure that there are a number of platforms available, that those are regionally distributed. So then that touches on the African manufacturing piece in terms of being able to have resilient supply chains and manufacturing bases, which is one of the things that frankly let us down in COVAX. And so I think in as much as those things are in place, already you're starting off from a much stronger base. And then you can talk about the financing, in the moment, so to speak. And so I think the pandemic fund obviously is an important part of that, in that it touches on a number of different areas. And so we at Gavi, along with many others, are looking forward to putting together, I think, some proposals in terms of reinforcing the pandemic preparedness. But then at the time also of response, so you mentioned it's what we call day zero financing, being able to have capital that's immediately available that has a very high risk tolerance, and that we're able to do. And Matt touched on this earlier on, in the sense of, if we cast our minds back, there were no licensed vaccines. We didn't have any idea how many vaccines would make it through, if any. And so I think having a very high risk appetite for that investment, and it's not just around the investment in terms of the production of the vaccine, it's the production of many vaccines. And so I think the scale element is really important here, in terms of how do we make sure that we can make some pretty important bets. And I think, just finishing the time dimension, if I may, this is also where we need to have a reasonable risk appetite for the fact that, as we say in forecasting, you could be roughly right, you're going to be precisely wrong. And we're always going to be in a situation where, so talking about vaccine production, we're going to be in a fluid situation around how the epidemic curve is going to evolve, and how the vaccine response and volumes required are going to be matched against that. So I think also being able to manage that, building in some safeguards initiatives upfront in terms of being able to be flexible on volumes, but also understanding that there needs to be a risk appetite over the fact that, if anything, we want to invest in vaccines, not underinvest, to have the best public health response.
Indeed. Thanks, Aurelia. I'm going to turn to Saul, but before I do, I just wanted to quickly remind everyone joining us virtually to please send us some questions. I see some coming in already, and we'll move to them next. But yeah, just a reminder, send us your questions on Twitter. We're at CGDev. You can send them in the YouTube chat window or email us at events@cgdev.org. Okay, so I'll welcome your thoughts on this topic of at-risk financing. And,
Sure.
I'm mindful just that we don't have anyone here from an MDB, but I'm mindful, and if I recall correctly, that entities like the World Bank, of course, put up a big a financing package to support countries with their vaccine rollout. But if I'm remembering correctly, they were not really supporting countries to purchase vaccines with their financing before the vaccines had received, EUA or EUL. And I think this sort of question about at risk, I think, is really pertinent. Of course, we're talking, from the perspective of Gavi and CEPI here, but I just wanted to make that broader sort of contextual point as well, that I think this is really a key issue, but it's also relevant to a lot of the different sources of financing that I'm hoping countries will still have available, next time around. But Saul, let's bring you into this conversation. Over to you.
Thanks, Janine. And just to say again, look, I think there's the pre-pandemic investments in preparedness are really important. And I think the key thing there is that they actually structure the options that you then have in an emergency. So if you've invested in your manufacturing, if you've invested and in scalable and pivotable platforms, if you've invested in R&D, that gives you a set of options in an emergency and the ability to accelerate things that you wouldn't have if you hadn't made those investments. And then when you do get into an emergency situation, I think the important thing also to notice that some organizations need to trigger much more quickly than others. So from an R&D side, I think CEPI triggers pretty much when you first see signals of something emerging, and others will start to trigger at a later date. And actually understanding that kind of cascade of triggers and how those fit together is also really important. And Aurelia said, the earlier you go, the more at risk you are. And so how can you understand what the kind of no regrets financing is and how that builds up as you find out more around a pathogen and you start to have to make larger investments. So as we start to think about sort of preparatory financing and surge financing, actually understanding some of those nuances and what kinds of financing triggered on what points of what scale and what's the cascade, that's going to be important. I think for countries and the bank, you do face a challenge, particularly when you're looking at concessional financing. Do countries want to take risks with concessional finance? And that can be hard. And I think there was an issue during the COVID response of, well, is there going to be grant financing? If there's going to be grant financing at some point, do I want to use concessional financing? And that's a really understandable trade-off that countries were thinking about. So I do think, if the bank is through its evolution paper, thinking about what's its day zero playbook, actually getting into how do you kind of buy down some of the concessionality of those financing instruments earlier so that countries can move earlier. And it might well be worth bilateral donors looking at guarantees in that space, perhaps to de-risk some of that concessional financing. And similarly, the bank had to be very much driven in terms of its country model by a country basis, and that made it hard to kind of act on an aggregated regional basis, which probably early on was going to be important in terms of the bank leveraging some of its resources. So I think that kind of regional piece and the kind of concessionality piece are things that we need to think about more carefully when we're thinking about the overall financing environment. We're doing some modeling work at the moment, and Javier is on the policy advisory group for that. So thank you, Javier, to try and sort of unpick the different levers that you can invest in to give you that speed, scale, and access sort of goal with vaccines. What are the kinds of different investments you make when? How do those look at the preparatory side of that? What does that mean for when you get into a surge piece? And what's the optimal risk mix of those? Which of those are no regrets financing? Which of them are fungible to broader health benefits in between pandemics? So that's something we're trying to actively explore. And we're really keen to do that with policymakers, not just economists, nothing against economists, but actually need to get down to breaking that down into things that feel tangible policymakers. I should say Africa CDC. Justice Nonivigon is also on that policy advisory group. So hopefully that will begin to generate some concrete, some tangible options in later in the year. Because sometimes we just say this, that it's a no-brainer: invest some billions now, save trillions in the future. But that's just too big and too difficult to unpack for policymakers. So I think we really need to dig into some of that as we design some of the financing work, and also look at what the regional investments and other pieces that we need are to make that work. Thanks.
Great. Thanks so much, Saul. I'm just mindful of time. We have 5 minutes left, and I want to, I know Matt wanted to come in to sort of comment a little bit on this point of at-risk financing. How do we think about mobilizing and using that financing? Lots of different sources of financing, as Saul touched on. But I'm also, at the same time, in the interest of time, going to share a question that touches a little bit more on allocation that came in from the audience. So if somebody wants to pick up on that, as you all are sharing some final thoughts, we can try and get to that as well. But I know, in terms of allocation of vaccines, if I'm remembering correctly from the report, that COVAX in sort of principle followed the WHO proportional allocation, but we had a question come in that talked about how COVAX was thinking about criteria that was used to allocate vaccines across countries, especially at a time when supply was so constrained. And I know that the evaluation, as we talked about at the top of the event, focused on a very specific time period. And if I remember correctly, this was sort of one of those aspects on which, things changed and evolved throughout the response. But I just wanted to make sure we got to that question. So maybe just in the interest of time, let's start with Matt, who wanted to come in on this point of at-risk financing. But then I'm going to just do one final round. We'll go to Akona and Javier next, and then if Aurelia and Saul have any final last words. But just really quickly, sort of 30-second, 1 minute, big picture takeaways on at-risk financing, allocation, or any other key learnings that we didn't get to, which is a long list that I have in my head, unfortunately. But over to you, Matt.
Well, Saul probably addressed it really, but I was just going to sort of comment on the need to make sure that your early stage push funding is really well aligned to your pull funding. Exactly. Can you put access provisions in your push funding at the start? Can you sort of really commit vaccine developers to use tech transfer in those early stages as well? You've got to then put your funding into actually facilitating the tech transfer as well. So I'll leave it at that. I'm not sure I quite understood the allocation question, but I'll leave it to others. Thanks.
Akona, over to you if you have any sort of, again, overarching thoughts before we close. Over to you.
Thank you very much. I think it's really important for us to, I have to speak on behalf of Africa, and so I think really prioritization of overall financing for us to be prepared for the next pandemic is key. And what I could catch earlier on in terms of really everything should start at a regional level before, even at a country level, really, to ensure that will. We have the political will, but then in terms of really proper implementation, ensuring that any financing mechanisms that are put in place are actually going to be able to be fit for purpose for the community that it wants to serve. I think it's really important for us to really highlight. And so basically I'll leave it at that, because then, before my connection drops off again.
Thanks so much, Akona. I'm really, so glad to be able to have you as part of this important conversation. Javier, over to you. Any big picture takeaways, things we missed and didn't get to that you want to make sure to mention?
Just wanted to invite you all, and I guess for us as the global health community, to keep this pandemic preparedness and response topic up in the agenda. I think there's pandemic fatigue. People don't think that this will happen again. It has happened in their lifetime. It might not happen. As Janine said, competing priorities. Politicians are not judged by what they do for the future, but what they do for the present. So I think we should all, keep the momentum, because the window of opportunity is rapidly closing. But with that, I just wanted to thank you all very much.
Thanks. Aurelia, over to you for any final thoughts.
Well, to add my thanks as well for a very rich discussion. And I guess to the question of allocation, maybe to take a step back, and then I'll get into the specific question. When we think about the impact that COVAX has had, so 2.7 million deaths averted, 75% of the deaths averted were in low-income countries through the end of 2022. And so I think that's a really key number. 89% of the doses went to what we call our AMC, so the lower income economies, where COVAX had the highest impact and averted the most deaths. And so I think that's a fundamental principle to always come back to in terms of equity. And then within that, there's the allocation question. So when we're in a situation, as we will always be, of higher demand than supply, particularly in the early days, we certainly had a lot of learnings in terms of how do we make sure that we allocate for all doses going to a country, not just the ones from COVAX. And I think and we evolved the mechanism, the evaluation speaks to this, but it really comes back to some fundamental principles around transparency, and how do we make sure that together within the partnerships with the countries and the manufacturers, we have that transparency of supply, the availability of information, so that we can get a clear picture and really orient the response towards what's going to have the best public health impact. And then there's downstream pieces in terms of allocation, I think, that have been good learnings for us in terms of how do we think about real-time accurate information. We know that with the CDS funding that we gave, of those countries who reported, almost half said that they were able to digitize their health systems thanks to the support that they had through COVID funding. So how do we use that to understand what the absorption capacity is within country? How do we use good stock information? And I think with all of those pieces combined, then you can get to a very impactful allocation mechanism. Thank you.
Thanks so much, Aurelia. Thanks for picking up on that. Saul, over to you for final thoughts.
So very, very brief. So this thing, and I think the emphasis on partnership and preparedness is really key. Let's not wait for the next pandemic as well. There will be big regional outbreaks. We can test different configurations of organizations working together in different regions. It will be different groups working together, building opportunities for trust and how we understand how to respond. So, there are opportunities as we think about how we respond in the future to actually test that out on smaller scales in the nearer term, and actually get to know each other better, get to know how to work with partners from different regions in different ways, and that's going to be really important as well, because in the end, practice will make, if not quite perfect, because it will always be unique, but it will actually help us so we can do that, and there's no excuse not to.
Great, thank you so much, Saul. I just wanted to say there is, much more to talk about, and more importantly, a lot more work to be done. I think we touched the surface on some of the key points. I'm mindful we didn't really get to talk about other very important key learnings, things around, focusing on delivery and thinking about that from day zero and day one, not so much as an afterthought. So a lot more to think about, talk about, and more importantly, a lot more to do. We have of course, the pandemic treaty accord negotiations are ongoing, continuing to happen in Geneva this week. We also, I'm mindful, have the upcoming high-level meeting on pandemic preparedness and response coming up at UNGA in September. Lots of key milestones to keep an eye out for, to think about sort of influencing and informing. But I just wanted to take this chance to, of course, thank all of our speakers here today for sharing your rich perspectives, but also for all of the work that you have done on all of these topics on the front lines of the COVID response over the last few years. And of course, just to acknowledge the broader team from Itad and 3IE that worked on the evaluation, and all of your commitment to accountability and learning from our experiences. So hopefully this is, just one conversation amongst many others that we will continue to have on these important topics. So thanks to all of you for joining us virtually from around the world, and see you all next time.